Welcome to the girls. I know that there is a topic on our show today that we're going to discuss with a guest, Dr. Scott Muir, OBGYN specialist, and he happens to be my doctor as well as is here your doctor as well.
Feeling hot, hot, hot.
Yeah.
That's a hint.
That's the hint. The topic's going to be menopause. If you break it down, menopause means men stay away.
That's for
because
sure.
it's a time of our life when we're just like, you don't know what you are.
Well, I have questions for him coming up because there is such a gap of when menopause starts and when doctors say it's going to start, and then you're listening to a guy and you think, you know, it's like some people start menopause early. Some people start menopause late. Some people have different symptoms. So we're gonna talk to him today because he's all of our doctors, so he's in trouble now.
Yeah, we're gonna have him in the hot seat.
Yes.
Yeah, but we have a lot of other things going on too, Lori. I see where you're going to be a chairperson of Christmas in Cunningham.
Yes, my favorite sister-in-law
Here I am.
called me up and said, "Hey, do you need a new project to do?" And
of course,
I said,
with all your free time.
Sure. So we like a good challenge, and this was a great project. I look forward to working with Jeannine on a different level, and you know, we're raising money for two great causes. Of course, the one close to my heart, Community Services for Sight, and then the Cunningham Crime Watch. So it really is a win-win for the entire community because it's a great community event. And then again, the organizations are all going to benefit from it as well. So I'm looking really forward to it.
And if people don't know what Christmas in Cunningham is, it's a community event held in our town where we live, Cunningham, Pennsylvania. And you know, I was born and raised in the Valley, and Lori now lives there too. My mom lives there. So we wanted to give back. The old board did a fantastic job setting this up, and the girl that ran it, you know, she's having a baby, so she needed a break. Here we are, we stepped up, and it is a big event. We're gonna have a Christmas parade. We're gonna have vendors and crafters and entertainment. I might even sing.
Oh boy.
No.
Here comes Santa Claus, here comes Santa Claus, right down Santa Claus
Well, if you
Lane.
want to hear Jeannine sing, you can visit us on December 7th from 11 to 4.
Maybe I'll just ring the bells.
December 7th, where's it going to be held?
Right in downtown
Whispering
Cunningham
Willows.
on Main Street at the Cunningham Whispering Willows Park.
You don't want me to
That's cool.
sing?
I guess
Jolly
I'll be
old
involved
Saint
at some point.
Nicholas.
Oh, yes,
Gee,
I'm sure
you're
you will.
really hurt. My ears over here. I know.
Rudolph the
red-nosed
red-nosed reindeer had a very
How much wine did you have before the show today?
And if you ever saw it, you would even say
All right, we'll stay right
like
there.
a
When
light
we come
bulb.
back,
All of
when we
the
come back, we're going to try and find out
reindeer.
how we can shut Jeannine up with Dr. Scott Muir, OBGYN. We're going to talk about menopause.
They never
Stay with
let
us.
poor Rudolph
Join in any reindeer games. Then one foggy Christmas Eve.
Welcome back to the girls. As promised, we have our special guest with us, Dr. Scott Muir, OBGYN for the Lehigh Valley Physicians Group right here in Hazleton, Pennsylvania. And we go back a long, long time, Dr.
Yes, we
Muir.
do.
We've been
Don't say
around
how
for a
long,
long
but yep.
time.
Well,
Yes.
25 years you've been doing this rodeo.
I know.
So I've had, I don't know how many women stop me and ask me, please do a show on menopause. Please, let's find out what are all the different stages. Does it last for 20 years, 30 years? People are suffering with this for many years. So why don't you just start by explaining what menopause is?
Yeah, we have to have the language right first. Menopause is a year without a menses in someone who normally would cycle. The average age is about 51 and a half years old, and it's been that for decades. It really hasn't changed. Girls are getting their periods earlier. I think we all know that in life, but the end is pretty much the same. The last menses is usually around 51, although there's a pretty good range. You know, anywhere from 45 to 55 is okay. If they go too early into menopause, they run into some problems, maybe early osteoporosis risk or heart disease risk. If they run late over 55 years old, they have a little increased risk of breast cancer and some other things, uterine cancer. But for the people in the middle, it's usually about the symptoms of menopause.
Okay, so what would be the first symptom other than your menses beginning to diminish?
Well,
So that you would think.
long before the cycles change, they start some symptoms associated with lack of estrogen, and that starts off as hot flashes usually. They're usually cycling normally, but they're noticing the room's a little bit warmer, or everybody else has a coat on and they don't, for whatever reason. And there's reasons behind it, but suffice it to say that the blood vessels expand and contract, and the blood from the core of the body goes to the skin. And that's what causes the hot flash. Their temperature does not go up. They feel like it is. They'll be sweating maybe. They'll be red in the face. They may get sweat running down the side of their face and at an inopportune time. But ultimately, their temperature is still normal. And so if you took a temperature, it would be fine. But what happens is the core temperature of your body is 98.6. And if I took 98.6 degree water and I poured it on your arm, it would feel hot because the temperature sensors are there. And this is what they get. They usually get it from at the chest up, and it comes as a wave. It'll last sometimes too long, a couple of minutes or longer at the wrong time, and then it will dissipate, and they get cold because it's sweat.
What happens then, Doc, if people out there have had hysterectomies? Does that increase when you should be going through menopause?
It's all about the ovaries. This is all, the ovaries are
so
the broadcaster, and the uterus is the receiver, and the skin is the receiver. So you can broadcast all day long. If you don't have listeners, you can still broadcast. And that's what the ovaries do. So they will broadcast right up until the normal time you would go through menopause, except you have to rely on the symptoms, not the absence of menses, but the symptoms of menopause. And we start looking for some blood testing, which is not perfect, but it's an indicator.
So if a woman had a hysterectomy and had both ovaries removed,
that's a different ballgame altogether. That's considered surgical menopause, and that is overnight. Overnight, they're in menopause. And you give it a day or two, the estrogen disappears that quickly, and they are symptomatic, and it's usually bad. Severe hot sweats, and they don't sleep properly. Some of the later symptoms of menopause, like vaginal dryness, and that kind of takes months. But in the beginning, it's surgical menopause, and it really needs to be treated early if they're younger, especially.
Okay, well, speaking of treatment, what is the treatment of choice?
Well, you don't have to treat a natural occurrence, but you talk to a woman who has hot sweats and night flashes and moodiness and irritability and vaginal dryness and sexual performance issues and all this kind of baloney, they want something done. Unfortunately, over the years, there's been some hysteria around the management of menopause. And I lived through this. There was a big study that was done, and we're not going to have time for it, but basically suffice it to say, it was 15,000 women, called the Women's Health Initiative Study. But it started with women that were older to begin with, and these weren't our target audience. These were women that were probably 63 in the study to start. And it was bad because what they said basically was hormone therapy, and hormone therapy is the staple of management of the menopause, is they thought it to be less healthy than not to do it. And so we had to fight this constantly over the years, and it lingers to today. Now, I will tell you that today you hear very little about bad things associated with hormone therapy.
That's because they're being started on hormone therapy earlier on in age. So if you're 63 years old and you're on hormone therapy and you may have heart disease and others, you may have had that already without the hormones.
That is exactly right.
All right.
Exactly right. So you're starting at a little bit younger, around the perimenopause or in the very early years. It is very beneficial for many women. I'm going to tell you what, there's very little things you can take in your life that will improve your quality of life to this degree this early. There's plenty. You'll take your high blood pressure medicine, you'll take medicine for asthma or whatever the heck it might be. But when you take hormone replacement, the effects are quick, they're dramatic, patients like it, they're compliant. I write a lot of it, and I'm going to tell you, when they come back the next year, they're still taking it.
Are the hormones natural? Are they made naturally?
All
Are they
right.
synthetic? Where are these hormones coming from?
That is an interesting topic. The body doesn't know one from another. It knows estrogen and progesterone, depending if you have a uterus or you don't. It knows that. It doesn't care if it has a fancy label on it. It doesn't care if it comes from a compounding place. The hormone is the hormone, and the body will react accordingly. So I have a preference for personally not using compounded medications. There's a little, the quality of control sometimes can be off a little bit. You don't know, not necessarily bad, but when you're getting medication that's been studied for decades, we know the skeletons in the closet, if any. We know. And I can share that with patients, and they can make an informed decision if this is something they want to do. So personally, whether it's bioequivalent or natural, it's not a word that I like to use. The body knows, like if you buy Tylenol that's branded or Tylenol that's generic, it's acetaminophen. The body doesn't care. It processes it the same way. And the same thing is with hormone replacement therapy. I use something that when I do use it, that I can rely upon as a track record that I can point to in safety studies that I can point to. It's consistently the same.
And at what age do you recommend this? I mean,
Well,
everyone starts at a different age, so do you recommend it early on?
This is the conversation I have. I call it menopausal management. There's a little bit of an art form to it. When you have an informed consumer, they're a better patient. They're a consumer of healthcare, but they're a better patient. So you tell them the risks, you tell them the benefits, you tell them the side effects, straight up, without a lot of the manufacturer hoopla, whatever associated. And you know what? They're going to turn around. They're going to probably try it, and I can tell them when they do. And this is in the period. This is before they quit completely with their menses. I can help them with that transitional phase. I could tell them within days they're going to start feeling better. And you know what?
Within days?
Within days.
Wow.
And I'm going to tell you they do. There's not this big delay. And what's interesting is that the drug companies are smart to this. There's other products now on the market that are addressing this population of the baby boomers are getting older. And they're not going to sit there like their mother did oftentimes and maybe not be interested or be afraid or not listening to the medical studies.
All right.
But
Well, I'm going to stop you right there. You sit right there. Like Doc said, we'll be right back talking more about menopause with Dr. Muir.
Welcome back to the girls. We're here with Dr. Scott Muir from Lehigh Valley Physicians Group. Dr. Muir, thanks for being with us, talking all about menopause today. So we were talking about hormonal therapy before we left, and what else could we, maybe that's not for me. What else is out there for women?
Yeah, hormone therapy is definitely not for everybody. It's very effective in management, but there are some other things that we can do. Now, over the years, and you got to think about even women with breast cancer, what do when they hit the menopause, or they have menopause? There are, for many years, we in the business have known there are certain medications with side effects that are beneficial to us. There's a category of medications called SSRI, selective serotonin reuptake inhibitor. I'm not going to bore you with that, but things like Paxil, Prozac, Zoloft. There's a whole family, Lexapro, Celexa. There's a whole bunch of medications used for depression. Well, we know, and we've known for years, that a very low dose of that medication can be helpful for hot flashes. And turns out that the Paxil, the medication Paxil, in a child's dose, has enough of a side effect that will reduce hot flashes for many women. And for those who are maybe not candidates for hormone therapy or just not interested in doing it, it's pretty effective. It takes a little time to come on board, but that's a non-hormonal management. But also you want to consider at this time, as you get older, you have to pay closer attention to your health overall. So proper diet, some reasonable exercise, aerobic exercise is effective in managing some of these. And I'm going to tell you, not everybody gets them the same. Some people are crippled by the symptoms of menopause, and some people breeze right through. And you wonder how that happens, but
I want to
I
slap those
remember
people.
days being in my mom's car. She was about 50-some years old.
52.
And I was in the back seat with my brother, and my dad's driving. So it's my dad at the wheel, my mom in the passenger, my brother and I. Dead of winter in Pennsylvania. Dead of winter. It was sub-below, and my mom decides she's going to have a hot flash and put all the windows
didn't decide
down.
to have a hot flash.
And we are freezing our butts off.
And you didn't say a word, right? You didn't say a word. You knew better.
Oh
Well,
my
anyone
God.
that comes
We
in
were
my house
freezing.
either gets a blanket or a sweater, because in my bedroom in particular, the air or heat is always set at 65. My husband always says you can hang meat in there.
Yeah.
Because it has to be cool. I mean, if he's cold, he could get warm, but I can't get cold.
Right.
I've been known to go outside and stand in the winter on the cement floor, on the cement outside in the snow, just to cool off.
It's a big
So
deal.
then I came across something, my little friend, and I've shared this with so many people. This one happens to be for my chiropractor, Dr. Scott Sacco. This is a gel pack that I put in the freezer. Right now it's not frozen, but I take this to bed with me.
Yes.
I wrap it in a towel and I put it in my bed before I get in, so my bed cools down.
That's amazing.
Then it goes underneath my pillow, and at any given moment during the night, if I do have a warmth, now I'm past the sweating, soaking hot flash stage, but I still get the warmth area where it feels, Doc, like claustrophobic. It almost is like someone has their hands around me, and that's how a lot of women
guys
describe
go
You got it bad.
Why do the women have to go for all this
I
stuff?
get this, so I'll
They live
place
longer,
it
it's preference.
wherever.
I thought she was was going to say she rings the bell. My dad comes in and like throws
Oh,
like ice on her or something like that.
That's good though, you know, that's not a bad,
sleeping.
that actually works.
That's not a bad idea
great.
either.
I'm sure it does.
And I do put, like, so if I'm having a hard time sleeping or I wake up in this panic, I'll put it on my wrist.
You know,
so
I'll remember
all the
that.
pulse points.
And there's a
I'll
reason
put it
that
behind
works.
My neck.
Yeah.
It just
Yeah.
calms everything down, and it just makes me feel cool.
Let me tell you, we know for a fact that women who really are resistant to medical therapy, that the traditional estrogen, we throw testosterone at them for the ones that break through, and they do better. So the fact that the men have testosterone, most men, you know, have enough testosterone that they don't have this issue. But testosterone, in addition to estrogen, is helpful in treating hot flashes.
Oh, really?
But
Are
not
there
too
side
much.
effects? Like, are you going to get like grow like hair on
Well,
your
that's
face and stuff like that?
Well, we know how to manage it. It's small doses.
Small doses.
Yeah, small doses.
Well, now we have different ages here.
Yeah.
So the age that I'm at, I'm already up over the hill and coming down the other side of the menopause part. So I'm pretty much managing what
Yeah.
I have right now.
You know-
But what are the dangers for me?
Yeah.
What else
well,
do I have
here's
to
one
worry
thing. Once a
about?
woman goes through the menopause, she's had her last period and she moves on, her risk of heart disease equals that of a man after that. Because estrogen tends to be protective for women, and when you pull that away, that's why women live longer. It is not preference. You just have this estrogen that helps you out, and the cardiovascular is better. But you got to watch the lipid profiles and that sort of thing when you get older, or older into the menopause range, just because it can switch, and you got to have someone take a look at it. If you have a family history of hyperlipidemia or high cholesterol, then you got to check for that, and maybe you need to have treatment where you didn't used to earlier.
And how about osteoporosis?
Osteoporosis, estrogen is very helpful in preventing osteoporosis. It's a treatment for women that can't tolerate other medications, but they lose the majority of their bone mass in the year and a half or so, right as they're transitioning through menopause. So that's why it's important to have adequate calcium and vitamin D in those years in addition. But women who transition with estrogen in those years, or hormone replacement therapy of some sort, will prevent the development of osteoporosis to the same degree.
So in addition to all of the symptoms that we just mentioned, what are some of the other things? I happen to know a few people, a few friends of mine, they've literally had such severe depression that it cripples them.
Well, they miss estrogen.
So
It's like a good friend. You know, estrogen affects mood. It affects mood. Many of the mood problems come because they don't sleep well. They don't sleep well. It's like you're constantly having a newborn and you're never getting that full night's sleep. Remember those days?
Oh yeah.
And you're miserable during the day. But it's the same. But the baby never gets older. So you have these hot flashes and night sweats at night, and you don't get that REM sleep you need for regeneration. And it can develop. People who don't sleep well can become depressed. And I want to say one more thing before we get to the end of the show. And nobody ever talks about it. All right. Nobody ever talks about it. It's the S word. You know. And that sexual intercourse is impacted by menopause. People are like, oh, I'm old and I'm too old now. I gave that up, or whatever it might be. Estrogen helps vaginal tissues in a lot of different ways. And if we don't talk about it, nobody does.
Right.
Sexual intercourse, there's no upper limit. There should be a lower limit probably for that one, but not on the upper limit. And so I have patients in their late 70s that are still sexually active, and the majority of them are, the woman anyhow, is taking some estrogen type product. But there are ways to do it safely. Let's not forget that tissue suffers at some point eventually in almost all women. So you got to think about it.
So does estrogen only come in a pill form, or is it on cream forms? Is it vaginal inserts? I've seen all kinds of things.
There's a lot of products that we have
Okay.
available. Typically, locally, there's topical estrogen cream. There's some estrogen inserts that can be used. You have to watch carefully on how that's monitored. We have ways of doing it safely. The E word doesn't mean the C word, meaning the estrogen doesn't mean the cancer word. We don't want to think that. The oral therapy can be used in combination therapy, depending on if you have a uterus or not. We have transdermal, we have skin products. Like I said, there are some that are compounded in pharmacies, and I'm sure they do a fine job, but I will use a patch on somebody that has a measured amount of delivery. That can be used. So you could go transdermal, transvaginal, oral. We don't really use injectables. There are some places that will put pellets in patients, and I'm not there because I don't trust the delivery system, quite honestly. But depending on their chemistries, you got to pick the right one. Women who have high triglycerides, they should use the patch. They don't, they can use the pill.
Okay, so in a nutshell, when should a woman first come to you? They should be coming for checkups. How often?
We like to see the annual exam. They could be spaced out for certain patients. You discuss that with your doctor. But in general, we do more than just, you're not a cervix walking in, you know. You're attached to the rest of the woman. And so breast exam, skin exam, eye exam, pelvic exam, it all is important. But I'm going to tell you, as soon as you become symptomatic, don't sit there, don't run to the over-the-counter stuff. That's a bunch of baloney, I'm just telling you. Talk to your provider, and they can give you some good direction.
And is it ever too late?
Yes and no. There's a 10-year window from the time of your last period. If you want oral medication, there's a clock that's running. If it's greater than 10 years from your last period, you're not really going to be a candidate for oral therapy, but topical we can use.
All right.
Well,
All your questions answered right here.
do you,
Live.
you have all this to look forward to? I've gone through
inevitable.
it and I've survived, and I'm still having little tail ends of it because it's like 20 years now.
Yeah.
So
yeah.
that's not fair, but anyhow.
But there are management options. There are.
Well,
Thank you, Doc.
Thank you so very much.
My pleasure. Thanks for having me.
Thank you.
Girls, if you're having any of the symptoms, get in touch with your healthcare provider. If you don't have one, call Dr. Scott Muir, and I'm sure he could take care of all of the problems that you have. And thanks again for watching The Girls. Hope you have a cool night.